I'm back here. Now I'm going to discuss about the caries and restorative part of the pediatric child in this discussion. So first of all, we need to make a note about the factors that are controlling the dental caries. So Keys has given there are three main factors which are controlling dental caries into a triad that is called as Keys triad, which includes bacteria, that is dental plaque, diet, that is the food, basically carbohydrates, and the host, that is the tooth. Okay, so these are the three main factors which controls the dental caries according to the Keys. Later a fourth factor was added in which this triad was converted into tetrad. The fourth factor is the time. Okay, this tetrad is called as Newburn's tetrad. Okay, so a caries triad, which is three factor, now is converted into fourth factor. The fourth factor is the time. Then comes a concept that is called as karyogram. Okay, so karyogram concept was given by Brathel in the year 1999. Okay, and they have integrated this into a software which is called as interactive karyogram program, in which he has given that caries is controlled by 5 factors, and he has divided the pie diagram into 5 sectors, like each factor denoted by a color coding and controls one factor. So that is green, color green. Color green is nothing but chances to avoid dental caries. So green is something good. Next one is dark blue, easy to remember, D and D. So dark blue is basically concerned with the diet, means the content of diet and the frequency of diet that we take. The next comes is the red. Red is the danger. Red is something like bacteria. The amount of plaque, or the quality and quantity of plaque, the organisms that are present in the plaque, basically they have an effect on the occurrence of dental caries. The next goes is the light blue sector. Light blue sector is nothing but susceptibility. It is based upon the combination of the preventive measurements that we take, that is the fluoride program, or saliva, increasing saliva secretion, or improving the buffering capacity of saliva. The next comes is the fifth factor, that is yellow factor. Those are circumstances. Circumstances are a combination of past caries experience and related diseases. Okay, so these are the 5 factors which are controlling the dental caries according to the Brathel in his karyogram. So they can give a karyogram based, like coding different colors. This is different colors: green or light blue, dark blue, red and yellow. So basing upon which the outcome of caries can be predicted. So this is a 5 factorial. So initially they have started at 3 factors, that is caries triad, followed by the fourth factor that is added, that is the time, that is caries tetrad, and now karyogram is there. Karyogram is a 5 factor one. Initially karyogram has started as a 3 factor, now it is converted into 5 factor. So now we have 5 factors, but due to modifications in the lifestyle or the food habits or many other things, now if a question is asked like caries, basing upon the caries now is considered as a multifactorial. Caries now is a multifactorial. Multifactorial means depends upon many factors. Like it depends not only like the host or the bacteria or the other aspects. It depends upon multifactorial, means it depends upon many other factors. For example, lifestyle of an individual has a role on dental caries. Okay, the socio-economic status of an individual has a role on dental caries. The educational status of an individual has a role on have a role on dental caries, because an educated person can understand the value of prevention or value of maintenance or value of hygiene. So almost every factor indirectly or directly has a role on dental caries. Now if a question is asked like caries is, means the answer should be multifactorial according to the recent trends. Okay, the next important aspect is the most common area, that is primary window period and secondary window period. Window period is something like an opening of a window. So whenever window is open, you have more chances of occurrence of an infection. So these window periods are there for almost all the diseases, means the age where the disease more occurrence is called as a window period of a particular disease. Similarly, caries is a bimodal. Okay, it has two window periods. One is primary window period. Simply, you can remember primary window period occurs at the eruption of primary teeth, and secondary window period occurs at the eruption of secondary teeth, that is called as permanent teeth. So primary window period mostly occurs in the duration of 7 to 31 months, and I hope you know that the first teeth that erupts into the oral cavity is 6 months. So it's going to take 1 more month for the bacteria to accumulate on the teeth and cause the dental caries. So it is 7 to 31 months, and secondary window period occurs at an age of 6 to 12 years. So all these two numbers are very, very important. What is primary period, what is secondary period? Why 7 to 31 months is called as primary period? Because primary teeth erupts, and the secondary period is 6 to 12 years, that is the permanent teeth erupts. The next comes is, okay, I hope you're very clear with this. This is again an important question in your final year, that is the initial caries. What is white spot lesion is a question. So white spot lesion is also called as an initial caries or insufficient caries, okay, which is most commonly seen on the smooth surface of the teeth, visible as a white spot. And the point to be noted, the important point to be noted here is it has intact surface. The surface on the teeth is intact. So it has intact surface, okay, and below this intact surface there is subsurface demineralization. Okay, so below that intact surface you have subsurface demineralization. You will have subsurface demineralization. So what is the treatment of this white spot lesion? The treatment of this white spot lesion is remineralization. It's not restorative treatment, it is remineralization. Don't ever restore or remove a white spot lesion and restore with a composite. Okay, white spot lesion is intact surface with subsurface demineralization. So what is the treatment? As it is demineralized, you need to remineralize it. So apply some remineralizing agents over that area. So the remineralization is going to start and the white spot lesion is going to disappear. So that is about this initial caries lesion or a white spot lesion. Okay, so we'll learn few important concepts related to the white spot lesion. Okay, so white spot lesion is how you will appreciate a white spot lesion, or simply how you will appreciate a normal thing in the environment. Okay, it's because of the refractive index difference between two mediums we are able to appreciate a thing. For example, if you keep water inside water, can you differentiate water inside water? No, we cannot differentiate. Why we are not able to differentiate? Because water inside a water, both of these waters will have same refractive index. So when the refractive index is same, you cannot differentiate them. For example, if you keep a bowl of water with a dye and a normal water inside a big pot, you can differentiate because of the color difference. The color difference is basically the change in the refractive index. So because a blue color will have a different refractive index, this means a blue color water will have a different refractive index when compared to a white color water. So you're able to differentiate. So this is a logic that is followed by the magicians. In most of the magic shows, okay, they use two different materials separately and they combine the material and you cannot differentiate them. Why you cannot differentiate them is the simple logic is they select the different materials which has same refractive index. For example, if you drop a piece of glass inside a water, most of the times you cannot differentiate the glass from the water because glass and water will have a close refractive index value. So when the refractive index values is different between two substances, you can clearly appreciate them. When they are very close, you cannot differentiate them. So that is a logic in identifying the white spot lesion. If you see the refractive index of air, the refractive index of air is 1. Air is 1. And the refractive index of water is 1.33. And the refractive index of hydroxyapatite. Hydroxyapatite is nothing but a structure, that is the tooth. Okay, your tooth refractive index is 1.66. So the refractive index difference between the tooth and the water is more when compared with the refractive index between the water and the tooth, that is less. So the simple logic is you can easily identify a lesion with a different contrast media. That is means a lesion can be easily identified if air is a media, but if it is a water, because water and the tooth has close refractive index. For example, when there is a starting of demineralization, so demineralization process starts, the refractive index drops. It may hit somewhere around 1.4 or 1.5, for example. So 1.5, 1.4 and 1.33, the refractive index difference is very, very less. Means a white spot lesion cannot be appreciated when water is a media added to it. For example, if you take a white spot lesion and apply water on it, the white spot lesion is going to disappear because the refractive index is almost the same. Okay, so and the same goes, like the white spot lesion can you clearly appreciated when you dry the teeth. So that's the reason why when you're appreciating the white spot lesion, you have to dry the teeth. Okay, and this is the basic difference between a white spot lesion and enamel hypoplasia. Whereas your enamel hypoplasia will not disappear when you apply water on it, when you wet it. Whereas a white spot lesion, when you wet it, it's going to disappear because the water is going to occupy the porous space. As you know that the water and the demineralized structure has almost the same refractive index, you cannot appreciate. Means it's just masking. It's something like a magic. So whenever you wet the teeth, white spot lesion disappears, and whenever enamel hypoplasia will not disappear. So, and the second important thing, as the demineralization level is not up to a level which can be appreciated on the radiograph, these things cannot be diagnosed radiographically. Okay, you cannot appreciate a white spot lesion on radiograph, and the only mode of diagnosing it is by a naked eye or by using a diagnodent. Okay, we'll learn what is diagnodent in further slides. Okay, so diagnodent is a mode by which you can appreciate a white spot lesion or initial enamel caries. Okay, there is one more thing that you have to make a note apart from the regular dental caries what we learn in operative dentistry, that is linear enamel caries. Okay, that is linear enamel caries. So linear enamel caries is also called as odontoclasia. Okay, which is most commonly seen at the neonatal line of maxillary anterior. These are most frequently asked question. You can clearly see and appreciate on this clinical pic. Okay, you can see a neonatal line. Okay, this is most commonly seen in maxillary anteriors. The reason is the neonatal line. Okay, so this is basically due to the metabolic defects or metabolic change during the pre-birth and post-birth, because it's most commonly seen in the neonatal line, and those metabolic changes can be due to change in the calcium level that is available for the baby, or it may be due to trauma during the birth, and these areas are more prone for occurrence of caries, that is dental caries. Okay, so okay, the points to be done is the other name. Okay, most common area is neonatal line of maxillary anterior, and the reason is the metabolic defects or the metabolic change between the pre and post. I hope you're very clear with this. The next comes is the pH. Okay, so the regular pH of your saliva is 7. Okay, the range is 6.8 to 7.2 simply. So whenever you take food and the bacteria acts on this food, particularly the food is the carbohydrates, when the bacteria acts on this food, the bacteria is going to secrete lactic acid. So whenever an acid is secreted, it's going to affect the pH of saliva. Means when a pH of saliva is 7, when acid is added, the pH is going to drop down to 7, below 7. Okay, so it is going to hit 6, sometimes it's going to hit 5. Okay, so there is something called as critical pH of enamel, that is 5.2 to 5.4. So whenever the pH of saliva hits the critical pH of enamel, the enamel cannot bear and start demineralizing. Okay, so whenever this hits 6 and comes to 5.2 or below that, the enamel start losing its ions, that is called as demineralization. When it occurs when you have sugars, that is carbohydrates, when you have bacteria, the critical pH is going to hit and the enamel is going to start demineralizing. Similarly, the enamel is going to take the ions from the saliva also when the things are favorable, when that is called as remineralization. Loss will be again mineralized back, that is remineralization. When it's going to happen, when you have a good prevention measurements like fluoride or good secretion of saliva. When you have good secretion of saliva, this pH is going to get neutralized. and the pH is going to back to 7. So that is called as remineralization. So a process of remineralization demineralization cycle occurs which moves around the critical pH, that is 5.2 to 5.4. So what is the advantage of adding a fluoride? Very simple. When you add fluoride to the teeth regularly contains hydroxyapatite. Okay, when you add fluoride to it, it is going to convert into fluorohydroxyapatite or fluorapatite. So when compared with a normal critical pH is 5.2 to 5.4, that is hydroxyapatite. When you add fluoride, fluorohydroxyapatite enamel will have a critical pH of 4.2 to 4.4. Means whenever the critical pH is going to hit 4.2 to 4.4, then only the fluorohydroxyapatite is going to occur a process called as demineralization. Until then it will not hit. So that is the advantage of adding a fluoride. So that is the critical pH things which moves around. Okay, you can see this. The critical pH of normal enamel is 5.2 to 5.5, whereas the critical pH of fluorohydroxyapatite is around like 4, that is 4.2 to 4.5. It is 5.2 to 5.5. Above which, below which, there is a process of remineralization and demineralization cycle. Okay, so we'll learn few important aspects related to the fluorides. There is something called as fluoride bomb or fluoride syndrome. Okay, something called as fluoride bomb or fluoride syndrome. Few people, they call it as hidden caries. When it's going to occur hidden caries, there is a caries because of fluoride. The process of remineralization occur. Okay, the process of remineralization occur, and there is remineralization only to the, for example, if you take this is a crown and this is a caries, you have caries here, but the fluoride content has increased and the upper part has undergone remineralization, so lost. But the lower, you're not able to reach, your fluoride levels are not able to reach the lower half, and there is something called as hidden caries, which is not seen, which is buried. Okay, that is fluoride syndrome or fluoride caries. You can call it as occlude caries also. Okay, which can be seen on radiograph but cannot be seen clinically because there is an intact enamel. Okay, so already learned that a device that is used to identify the white spot lesion is diagnodent. Okay, so this is a picture of diagnodent which is given in AIMS once. Okay, they have given identify this diagram, or they can ask you to identify the wavelength of light that is used in this diagram, or the principle that is used in diagram, or the scientist that is concerned with, or the range of numbers. They can give you the number here and they can ask you the that diagnosis. So all we are going to learn. So this diagnodent diagram is very, very important. So coming to this, diagnodent was given by Lucy et al. Okay, so Lucy et al. And what they have used a new laser fluorescence system in this. Okay, they have named it as diagnodent, which helps in diagnosing or identifying the dental caries. The numbers varies from book to book, but basically you can make a note. Okay, a few people, they say it is from 0 to 99, and in your shop attendant it is from -9 to 99. If you have -9 to 99 in the options, go for it. If not, you can go for the second best option, that is 0 to 99. The range is 0 to 99 or -9 to 99. -9 reading is the tooth with the highest value. Okay, tooth with the highest value. So these are the ranges. Okay, so these are the ranges. If the value is from 5 to 25, then you can call it as initial caries lesion. Okay, if it is greater than that particular range, then it is called as early dental caries. Okay, if it is greater than 35, okay, if it is greater than 35, then it is called as advanced dental caries. Okay, so these are the ranges, and the most recent, that is KO, has given these ranges. Okay, that is 0 to 13 is called as no caries, 14 to 20 is enamel caries. But the treatment, they can ask you, they can just give you the number, they can ask you what is the treatment. Here it is prevention caries advised. 21 to 30, that is dental caries, or prevention or operative care basing upon the risk. When it is the value is more than 30, then you can go for an operative care. Okay, so they can give you simply, okay, this particular device has a reading score. when applied on a caries lesion, the value is 45. What is the treatment procedure that you have to go for a cavity restoration. You have to remove the caries by an operative procedure, by an invasive procedure, and then you have to fill it with some composite or GIC. So basing upon which they can ask some questions related to the numbers also. So there is one more device called as mini D caries. Something looks like a pen. Okay, when you keep the pen, you will have a reading here, a reading or with a color coding. Okay, so basing upon that, they can ask you a question. This was question that is given in one of the recent examinations of NEET. So a color coding of green color is something like a safe zone. An orange color is a limitation of the safe zone, means you're approaching. Okay, and a red color is going to be the danger of penetrating through the dentinal layer. Okay, so this mini D caries has this principle of identifying which type of caries it is, and the same color coding is also applicable for few aerotors. Okay, for few aerotors, like if we use aerotors, right? So these aerotors will have a color coding which is going to give the approximation of the pulp. Okay, like for example, if it is approaching dentin, it will have a different color coding. If it is approaching the pulp, it's going to give a red color signal that yeah, we are approaching the pulp, don't go very deep, you may have a pulp exposure. The same color coding, the same methodology is being approached. That is basically because of the difference in the temperature change. When you approach the pulp, there will be different. So because of the thermostat, there will be variation in the color coding system. Okay, so I'll be posting one more video basing upon the classifications that to be noted. Like apart from GV Black classification, there are many other classifications that are very, very important in examination point of view, which will be uploaded further in the next part of this caries and restorative part of pediatric child. Thank you all. Signing off from Team MDS Conquer.